So can you tell me a little about your experience in working with young people and eating disorders?
Well, I've been working in a local CAMS service in South Wales for the past year, and as a systemic family therapist, so I've been from the start being involved in the development of a specialist eating disorder team. Well, it's a virtual team incorporating a number of different professionals. So it's a family-based treatment model based on the Maudsley model. So it has a number of different phases, and it incorporates family therapists, nurses, doctors, psychiatrists working together with the family to support the young person to recover from the eating disorder. And obviously we want the work to take place as quickly, effectively, and as targeted as possible, so that the child doesn't get such entrenched anorexic behaviours, which really work against the treatment. The longer the child's had the problems, obviously, the more difficult it gets. So the sooner we can get involved, work together with the family to support the family to help the young person to recover, the better. So that's the context. And that team is in its infancy, so it's just being developed. And we've just had some training on the Maudsley model. We're just beginning to put in protocols and processes and to find our feet on the different kind of strengths we have as a team and what we can all bring to work with the families that we're all involved with, really. So it's a work in progress.
Yeah. So that would bring us on nicely to how have you utilised NVR in that work with the young people?
Yeah, well, I think that's something from the start that I thought there was going to be a need for it. And the sort of challenge for me has been thinking of how to weave it into an established model that's being used within the team, the Maudsley model, which is a family-based treatment model. Family therapy is right at the centre of what we do with families. And I think that as I've grown in my own confidence over the months working with families, that the areas I think NVR's got particular value in is around coaching parents to help their child to withstand the anxiety around eating, and to help parents to employ de-escalation techniques and step out of the pull towards conflict with their child, which really impacts on the relationship, and stay connected to the child. So though that they're having to do something that the child finds very, very difficult, it's coming from a place of compassion and care and love, and the parent stays with that part of themselves while they at the same time support the child to do something that's incredibly hard, without getting involved in these ongoing escalations and battles. And I think that's been an important part of it, and specifically offering parents coaching, practical coaching. Parents will say, "What do we do? You're telling us to get our child, the child to eat. We know we need to do that. We don't know how." And so I think NVR has got this very practical, well, I can help you with that kind of model, where I can sit and what I've been doing and I've started to do very early on in treatment is to meet with the parents on their own, not with the child, so that we can have these conversations, difficult conversations where parents might be revealing real vulnerabilities and their fears, the difficulties that they have, and say, hold that, and at the same time say, we can work with that and I can support you, and this is what we do. So bringing in the role plays, bringing in the ideas about how escalation happens, looking at what happens in that family, their family, and at the same time keeping connected, because I think that's the thing that goes awry with many of our families, doesn't it? The kind of disconnection between child and parent.
Absolutely.
So I think that's one of the areas I'm really interested in, and alongside that, working with the Maudsley model, which is involved in breaking the secrecy around the eating disorder, the anorexia, wants to take control, doesn't want other people to know, not wants to keep the secret. So working specifically to make sure, who else needs to know, how else can we bring in supporters, and maybe more, quite early on, having a meeting, a supporters meeting. How can we support the parents to help them help their child? What can we do? And who can help the child? Who can mediate between the parents and the child? So bringing in those ideas more specifically, again, at an earlier stage. So I don't know.
That's a really good answer. I'm just thinking about the other question about what particular considerations are there working within this context.
Well, there's always the element of risk. I mean, anorexia particularly I think it's got the highest mortality rate of any of the issues that we encounter in camps. We're really mindful of the seriousness and the medical implications of working with seriously underweight young people. And that's why I always work as part of a multidisciplinary team. I wouldn't consider doing this work on my own. I wouldn't work independently with a young person with an eating disorder. It has to be done in a holistic manner, and my bit fits in with the wider team. And if a child's weight is becoming seriously concerning, then I'm bringing other people in to support me. We have to think about the effects of starvation on the child's thinking, on the the child's bodily functions. So we're having to monitor blood pressure, pulse, weight, height on a frequent basis, and admit the young person to an inpatient unit should that become a real serious concern. So I'm always really mindful of the medical kind of complexities of it, and also the high level of anxiety that young people show around being weighed, being put in a position where you're expecting them to eat feared foods. I work with a dietitian specifically as well. One of the things that's very helpful actually in the parent coaching aspect is, particularly at the beginning, is we give out set meal plans which are around restoring regular eating and then maintaining weight. And it's very helpful for parents to have those as a way of kind of validating that it's all of us working together. It's not just them forcing this food on the young person. This is a dietetic, balanced diet. It's got weights on there. We can measure things. Nobody's forcing them to eat more. The parents are not being anything less than transparent with their young person. It's all done in this very open way. I just couldn't emphasise enough really that the team approach, I think. It's highly anxiety-provoking work for the worker, so you need your colleagues around you.
So I'm just thinking how that is in line with the NVR principles about recruiting a support network. So just hand in hand as the parents would recruit that support network to raise their concerns about a behaviour that's unwanted, it would be very much the same within your team, that you would recruit a support network to support you through that journey as well.
Absolutely.
And also breaking some of the taboos. You mentioned about how parents are exposed to what the work you are doing. So there's no secrecy involved?
No secrecy, no, not at all. And I think that's something that fits in really well with the Maudsley model, because that's what's done. We don't have secrets. We're here because we're all ranged against anorexia, not ranged against the young person, but we are fighting the anorexia, and it's hard, and we have to work together. And the young person would have opportunities to work individually with a therapist, as well as the parents working with somebody like myself, with the parent coaching, as well as a family session, as well as the medical overview and the dietitian. So you have your layers really of support.
What are the other opportunities that NVR might bring to the work?
I suppose NVR can in some cases, and I'm still at an early stage with this in terms of how you might use an announcement with a young person. I think that could be really useful in terms of just helping the parents acknowledge that they are going to be doing something maybe differently for themselves and their young person, and it helps them just to make that statement. this is our line in the sand, as we would say in NVR. So this is what we're doing, and actually also gives the extra bit of transparency to the process. And we are going to be calling on other people, and we are going to be using our supporters to help you. And you can get a campaign of concern going and a sit-in, can't you, from that basis of the announcement, to give extra weight by using those NVR methods of resistance to the anorexic thoughts.
Yeah.
So, but as I say, I think it's early days thinking about weaving this more practically in, because there's a time constraint around what I can offer within the kind of family therapy setting. And I think more proactively and more immediately, it seems to be the coaching around de-escalation at the beginning. And also, I forgot to say, actually, it's the reconciliation gestures that come in for the parents, so they don't forget, this young person has got lots of unmet needs that need to be recognised. What's going on beneath all this? Can feel very distancing behaviour, attempts to do things on their own. They don't want people involved in this. This is their thing. So to bring the parent back into that child's life and to say, I understand, I get you, I still love you, I'm still here, I will always be here. And I think that's a really important message. And the NVR allows that to be done really specifically. And sometimes I've noticed with a few families that within the couple where there's conflict, particularly perhaps where a father has been pushed out of the equation, the escalation strategies and the reconciliation gestures allow for that couple to unite more, come together. So yeah, I think that's perhaps an add-on to it.
Yeah, yeah. What other opportunities are there for further development, do you think, in NVR in this area?
Well, I just think lots of practice. I'm guessing that there are lots of people like me out there probably who've been trained in NVR, who are doing their bit within this kind of service and probably using NVR within eating disorder teams like this in similar ways. And I would love to ask people to, let's kind of find ways of connecting and talking about what we're all doing and how can we utilise people's experiences. I think that NVR, with all the parents I work with, it really helps bring parents back into the equation, and it also recognises the suffering of the parents. The focus is so often on the child, and we neglect really what it's like for the parent. And I think what the NVR can do in a situation like this, as it does in many of the applications, is to really put the parents back centre stage and recognise and validate their experiences and put the therapist alongside the parent to be able to sort of push forward that the parents' desire to change things, to want to help their young person show other aspects of themselves. I'm hoping that we can develop all of the aspects of NVR within the eating disorders kind of application, but I'd love to hear from what other people are doing to see what's happening, because I don't think there's anything really written down, especially particularly in English. I think maybe there are people in Israel and Haim's team doing things, but nothing here. So it would be lovely to have some thoughts from people.
Yeah, and would some of those parent thoughts as well, if there are some parents that are applying some of the principles of NVR, it would be really lovely to hear from their thoughts, so how it has encompassed their role as a parent and raised their presence within their child's disorder.
Definitely. Yes, you're right. And I've already had verbal feedback from parents. In fact, just last week I was asking to parents about what their experience of the process of working with the team had been, and specifically about this parent coaching aspect. And I think I'd started work with them about maybe 3 or 4 sessions in, and they actually said to me, it would have been nice to have had that even earlier. So, and I thought, well, that's really good feedback. Even though that was really quite soon, they would have wanted it offered from the start.
Wow. Okay.
And I thought and it was one of the most valuable things they said, in terms of helping them to separate out what was anorexia and what was their daughter, and helping them to be more confident when they could hear well, this is the voice of a challenging teenager. This is the anorexic voice. And to be able to do that kind of, do need to be able to set some boundaries here. Maybe need to do things a little bit differently around this anorexia. There needs to be a bit more gentle coaching, recognise the anxiety. But this bit here, maybe not so much. And that was useful for them.
And how they could quite easily cross over.
Yeah, and they had, and I think this is another point to make actually, they had a good, strong attachment, the parents with that child was a good relationship to start with. I think there are complications when you're working with children and young people, as with any of our work in NVR, where the attachment is insecure, avoidant, ambivalent, all of those sorts of things, and where there are other additional issues, maybe a child who's on the autistic spectrum or who's very, very anxious, where there's OCD, you're layering complexity on top of what already is a very difficult disorder to treat. So, success is obviously going to be greater where you're coming in with a young person where the eating disorders caught early and where there are fewer other stresses on the family and on the child.
Yeah.